She's that nurse that when you walk into the emergency room, whether you're a staff or you're a physician, you kind of take that big sigh of relief and say, oh, everything's going to be okay.
I enjoy coming to work every day, working with my peers. That's like my second family. I enjoy taking care of the children and the adults, helping to ensure that everybody's safe, making sure that we're trying to help heal people. We get hugs all the time from the kids. We know that they're feeling better. They always say thank you, and just the happiness and knowing that we've made them feel better just holds a special place in my heart, because I know I've done something good, and I just love hugging these kids afterwards.
Randi is probably one of our best team players. She does an amazing job of balancing out the patient's needs, the patient's family's needs, while taking into consideration the needs of her coworkers. She's always a team player. She's always willing to get in the trenches, even when she's the charge nurse, help her fellow nurses out. She just does an amazing job of keeping the whole ER balanced.
She was dealing with an infant. The infant was very sick and was having hallucinations. And she happened to walk in the room when the mom and the baby were there, and the baby stood up and began to jump off the bed. And Randi caught the baby kind of in midair. Randi sat with that mom and held that baby and rocked the baby throughout the night for many hours. And you know, that's just the kind of person that she is. She always makes sure that everything is taken care of. She's that calm coolness that you need in a level 1 trauma center like ours.
So when you pull all the qualities of Randi, I think about a caring person, very competent, very focused on critical thinking skills. The most important thing that puts it all together for her is what we are well known for. That is the fundamental kindness that she has that threads all these skill sets to allow her to make a difference in the life of the people that she serves.
For the patient, she's very, gets down on the kids' level, she gets down on the adults' level, she gets, tries to, relate to people and feel what you're feeling.
Randi Bos, she's a unique young lady, very dedicated to the healthcare profession, very dedicated to emergency nursing. She's a role model for our veterans, she's a trainer for our rookies.
I had the opportunity to work with Randi on 7 different occasions. The first occasion I worked with her, we had 4 kids in a house fire. We had a girl that was hit by a car, and we had 8 people shot in a shot house in less than 1 hour. And her professionalism was just off the chain, okay? But her compassion was more.
Randi is the calmness in the center of the worst storm.
Unfortunately, when we get pediatric traumas, pediatric cardiac arrests, it can be extremely stressful for everyone in the emergency department, from the techs to the doctors, and Randi is always a rock in those situations.